Today, our first case is a 65 years old man, has medical history. The patient has hypertension, rheumatoid arthritis, and is currently undergoing treatment with hormone therapy for prostate cancer. As a cardiology history, paroxysmal non-valvular atrial fibrillation under treatment with flecainide stand out. In August 2022, he suffered an intracranial hemorrhage while being treated with apixaban. He was referred to our center for atrial appendage closure. The analyses are normal. The electrocardiogram is in sinus rhythm with narrow QRS, and the current treatment for him is bisoprolol, prednisone, flecainide, and amlodipine. Today, we perform closure of the left atrial appendage guided by a transesophageal echocardiogram.
We can see now is an appendage that is kind of small, but has a little lobe that we have measured now without the contrast, but it measures around 19 millimeters approximately in AP dimension.
Okay, thank you, Leo. So as Leo said, we have ruled out the presence of thrombus. We have prepared, just in case, a three-ward system to protect the embolic complications, but we are not using it because of the absence of thrombus. So we did the setup is a femoral access. We have prepared a preclosure with a ProGlide. The patient is intubated, and now we are after the transeptal fracture that is posterior and a little bit caudal. We have entered without any difficulties in the left atrial appendage, and we are going to perform some angios and to fill in the appendage and measure properly the dimensions. Yes. We are doing the caudal projection.
So this is the diameter, the 3D diameter, the same, the bigger one.
So it's bigger than before.
Yes, it's around 1920 in this projection.
Dr. Galeote is measuring the angio as well, to have all the measurements and to be as accurate as we can with the selection of the device. So after these measurements, we are going to advance an extra support wire, long wire, through the pigtail to maintain it into the appendage. Sometimes, especially in cases of thrombus, we advance this wire to the upper superior pulmonary vein, just to not to touch any thrombus in the appendage, but sí, muy diferente. Está en otro sitio. As you see, the controversial point here is that the measurements now are very, very different from the initial measurements.
20 por 17.
And we have measured this, Leo, at 10 millimeters from the ostium, ¿no?
So tiene una zona que es una zona más estrecha.
Mira, Guillermo, look, here there are two areas that increase the size and a neck and un cuello en medio, ¿no? So
has a little neck.
We want here to land before the neck.
Yeah, that's it. So if we take this measurement is smaller, but just a little bit that it increases by a significant amount.
In the angio we have 15 by 14, so similar than the initial measurements in the 3D echo.
Let's measure here. Maybe.
So the measure
we are here in the neck, so I guess es que varía muchísimo justo ahí.
This is the circ. I mean, yeah. Probably this measure is more accurate, near than the previous one and the angiographic one. As you see, we are spending the time we need with this part because it's a crucial point of the procedure. Yes, we are checking the landing zone and also the ostium because we always try to occlude the Marshall with the disc. This is another controversial point because with some devices, as Watchman, as you know, you are not occluding never the Marshall. We have reviewed our cases with Amulet, in which we have covered the Marshall and compared them with the cases in which we didn't cover it, and we have no difference. So we still try to cover the Marshall with the disc, but if we don't cover it, we are not concerned about that. Okay, my colleagues outside the cath lab in the control room are checking again the sizes of the sheath and the devices with these measurements, 18 by 18 more or less, that I think by heart that is a 22 device that goes through a 12 French sheath. Probably we can prepare the sheath if Guillermo. Okay, so we can prepare the 12 French sheath because we're going to use the 22 device, no? Okay, Ruben, give us the sheath, please. The sheath. Okay, so we are preparing the sheath. The first thing before advancing the extra super wire. Choose. Sácate de la mascarilla. Okay, so before retrieving the transsectal sheath, we are preparing the sheath of the device. That you know is a conventional sheath with a dilator and a proper sheath. Ya no vamos a ir a más. Guillermo is thinking that from a 25 millimeters device and bigger, we need a 14 French sheath, but we are sure, or I am almost sure, we are not needing a bigger device than 22. So we are going through the 12 French sheath. Okay. Okay, so we are preparing everything before. I don't know if the camera can focus on the preparation of the device. Thank you. So the device, as you can see, is pre-mounted. It's easier for us to prepare. So the first thing is to secure all the connections to be sure there is not air on it. Guillermo is pushing the device to the tip of the introducer, and then I'm going to maintain it inside the water, and Guillermo is going to flush all the ports of the three-way stopcock and also the Y key. Okay, it's almost impossible to remove all the air, and I don't know if the camera is, yeah, I think so. So he's doing some negative pressures, pushing, pulling several times. And we are looking, confirming that there is no air bubbles inside the water. The last movement is pulling, close the stopcock, and we have prepared the device. So we are going to advance the extra super wire. ¿El TCA está bien, chicas?
¿El TCA?
La que tú quieras.
200. 230, Alfonso.
Tenemos que subir la parina, ¿no?
350, ¿no?
300.
¿Podemos bajar la luz ya un poquito? So you see the compression of the appendage. There is another thing to consider. Sinus rhythm, yeah. Ayúdas. Una gasa mojada, por favor. So Guillermo is retrieving the pigtail, maintaining the wire inside the appendage if we can.
Yes.
¿Qué suena, tío? Y que no hagan ruido. In the pulmonary vein, the upper vein, as I told you before, because of safety reasons. Espera, voy a estirarla que se acuesta. We have to remove the transseptal sheath, trying to maintain the wire there. So I'm going to compress the femoral vein, and Guillermo is going to retrieve the sheath, maintaining the position of the wire. And we do this only when the sheath of the device is prepared. Okay, I have the wire. Chus, tira del... Rubén, ¿podéis cerrar aquella puerta, por favor? Okay, so we are going to advance the sheath of the device, 20 French sheath. It's another important part. Looking the angio, maintaining the wire there. Okay, it's easy to advance. If not, we check the groin. I think I am advancing easily, Guillermo. This is a very good projection because we see the sheath and also the tip of the wire. I'm advancing here. You always need to rotate a little bit to advance. So we are advancing through the septum, and we are here. So advance a little bit counterclockwise to cross the septum. I'm crossing, so I'm going to retrieve a little bit the dilator, a little bit, and advancing the sheath inside the appendage. Leo, ¿estoy en la orejuela?
Let's check. Just checking. Yeah.
Okay.
Yeah, you're in.
So I'm going to retrieve the dilator and also the wire, maintaining the sheath inside the appendage. Okay. Probably I am touching the wall. Okay, there. Okay, perfect. So we are advancing now the device. We are connecting. We are connecting with water here. Okay. Okay. So some people advance it directly. Okay. Guillermo always check there is no air inside the system. You can see, I don't know if you can see, but there is back bleeding in the sheath. Okay. We are working in this projection in the cranial view because we think this is the best one. Choose. We are advancing the device. Seguramente está muy avanzada la vaina, ¿eh? No, ok. Guillermo, have check. Contraste, ¿no? Voy a retirarme un poco, ¿eh? Es que estoy muy metido, ¿eh? So we are deep inside the atrium, and Guillermo is pulling the lobe outside the sheath. We are very deep in the appendage, but it's, I think, a good site to go back. Leo, you can retirar un poco, ¿no?
Yes. Gotta go back a little bit.
Un test, choose. A little bit. Probably is there the landing zone.
Yes. Yes.
Okay. So Guillermo is doing the maneuver, advancing the device and retrieving the sheath. I am maintaining the counterclockwise. Okay. Sí, I'm maintaining it.
Yes. Seems right.
¿No está un poco fuera? No.
Yo creo que no.
En el plano de la derecha, digo. Okay. Let's try to advance the... Le digo porque está en ritmo sinusal y en el plano de la derecha ves que está el ras, ¿eh? ¿Ves? Uno de los lados.
Yes. I think it's in a good zone.
In a good zone, okay.
Yes.
So we're going to try to open the disk. Guillermo is pulling back the sheath and pulling the system. Look the angio. I'm maintaining the position of the wire, the sheath, sorry. And this is the disk. And okay, I think it's a very good position there.
Yeah.
Okay, sorry. Okay. Okay.
It seems right.
So we have to check it.
Circumflex
We don't have ECG. Yeah, there.
doesn't take the Mitral.
Yeah. Guillermo is going to confirm the
talk test.
that the device is not moving with the tag test.
Okay.
You can see a very aggressive one. And the device is stable.
Very good.
Guillermo?
Yes.
Okay. The device is stable in the echo, in the angio, the feeling also. So let's check with echo. And if
Yes.
you agree, we can...
Yeah. It seems okay.
It seems
With
okay?
that, yeah.
For now. Let's deliver the device. I don't know if the camera can show this. This is a torque, just to do some movements counterclockwise to freeze the...
We need to open the key.
This is very nice. Está ahí sobre la esta.
You see
no
the-
toca la esta.
the screw, and now I know why sometimes it happens that the device is not being apart from the screw. Are you sure it is maintaining the... Probably, yeah. Ya está. Okay, so the device is delivered. Let's check again with everything, but I think everything is okay. In the echo, at least, in the angio, hemodynamics.
Yeah. No leaks apparent.
¿No has cogido el Marshall? No, por debajo, ¿no? Justo. Por debajo, no. Is the thing, the debate we have told before. We are below the Marshall,
Yeah.
but there is no leak. And probably to cover the Marshall, we need a very big disc, another device that does not fit with the landing zone. You have two options. Choose a specific device with different sizes of the lobe and the disc, or not covering the Marshall. That is a good option. And is the thing you are doing with a Watchman device, for example, with no issues. Okay, we are done.
Okay.
So we are retrieving the sheath, the PA projection. El avanzador ProLight, por favor. And as I told you before, we are closing with one ProLight, a syringe with water. Okay. Okay, I have the blue one. The feeling with the ProGlide, with this ProGlide was a little bit strange, so probably we'll have to compress after that. But it is a vein, so we decided not to advance a second ProGlide. Espera, Guillermo. Okay, you can retrieve it.
No tiene leaks, you know.
Okay, the sheath is out, and the ProGlide, I think, is working. So we are going to close it, and I think we are done. So thank you for being with us, and we see you in the second case. Thank you. Bye bye.